thank this organizing committee given me the opportunity to talk about this role of technologist in non-contrast perfusion imaging. In the recent years, there is a lot of development in MRI imaging. It helps to diagnose the problem is earlier and accurate. It's like one of these, the perfusion, non-contrast perfusion imaging. My content is like introduction, types of perfusion, traces for perfusion measurement, working principles of ASL, types and limitation of ASL, clinical application, and patient reference. So what is perfusion? The delivery of oxygen and nutrition to the tissues by means of blood flow. It is called it as like a cerebral blood flow. The volume of arterial blood delivered to a capillary blood of that tissues, the specific period of time. That is like a cerebral blood flow. It is measured in ml of blood under some tissues. Typically in human CBF is 60 ml of by 100 grams per minute. So modality for perfusion imaging, PET and SPET for nuclear studies, CT perfusion for CT imaging, MRI based perfusion, contrast and non-contrast, the T2 dynamic susceptibility based on AC, that is contrast. Another one is T1 dynamic contrast enhancement, that is like a contrast imaging. Another one is non-contrast imaging, that is arterial spin labeling. So advantages of that MRI perfusion is non-invasive, non-ionizing, co-registration with high resolution anatomical MRI data, higher spatial resolution and temporal resolution. The quantitative without like an arterial monitor. The traces for like a perfusion imaging. So iodine for computer tomography. So gadolinium for MRI. OH2 for like PET. This can be not repeatable, but the patient with any contraindications or renal failure or like a pregnancy or like that is it's not possible in that, or it's like a perfusion, contrast perfusion imaging. But so only one thing is we can repeat that arterial spin labeling. So brain perfusion is like divided into two types. One is like contrast imaging, it is called as exogenous traces used, and another one is non-contrast, that is like arterial spin labeling. Here we are using the blood for the traces. Another one is like this history of like arterial spin labeling. Early development in 1992, Williams et al. Used water as a tracer to measure cerebral blood flow in rat brains. In 1992, Ditter used to ASL for study in human brain. Current status, ASL now available for routine clinical practice. It is used to detect the early sign of stroke, dementia, and multiple sclerosis. It is also used to monitor disease progression, and ASL is used to study brain tumors, epilepsy, and neurodegenerative or disease like Alzheimer's disease. Challenges? Yes. ASL has a low signal to noise ratio. It has a number of sequence variants. ASL has a complex post-processing requirement. Recent development is like ASL has become more robust with short acquisition time, higher resolution images, and fewer artifacts. ASL has become more widely available in clinical MRI scanners. ASL used for conjunction with or as an alternative to DSC. So what is like ASL is like a modern, like we can use in modern higher end modalities. It will give like a time inversion blood is longer. We can get stronger ASL label. Stronger ASL label gives more ASL perfusion signal. So limitation, yes. So low signal to noise ratio, sensitive to motion artifacts, transit time issues, limited spatial resolution. Potential pitfall is like patient's factors, the magnetization transverse effect, vascular disease impacts. What is arterial spin labeling? Arterial spin labeling ASL is a non-invasive MRI technique that measures cerebral blood flow in tissues. It uses radio frequency pulse to label in water arterial blood without need for contrast. So labeling means changing the blood magnetization. So see that this is the method we are labeling that inverted the protons in water in our blood. So this you can see is how that transverse magnetization happen here. So here. So this is we are applying that 180-degree RF pulse. Audio please. Kana? Audio. Kana? Audio. This is happening in the proton level in our blood water. Okay, so basics of ASL is basic idea is to use arterial blood as an endogenesis tracer. ASL used to radio frequency RF pulse and of arterial blood. Apply inversion 180-degree or RF pulse. Wait for some more time. So label the water. To label in label image, again we label image, that is called it as a tag image. So repeat without 180-degree RF pulse, so that is it is called as control image. So control minus a label image, we will get perfusion imaging. You can see the picture over here. We applied 180-degree RF pulse. So it's inverted, it's going, and then it's again relaxed. Before that, you have to take the image. That is it is label image. So without any 180-degree pulse, that is control image. So the control image minus tag, we will get a perfusion imaging. So this is a small video of that how it's working in our brain. So we are going to apply 180-degree RF pulse here. That is inverted, which is going inside. And perfused, we are taking that image, that is called that tag image. So again, without 180-degree RF pulse, we are acquiring that image, that is control image. So control image minus tag image will get the perfusion image. So here you can see here, it's we are applying this a 180-degree RF pulse. So what happened is that protons are inverted. So inverted, so going through inside our brain. We will take the occasion, that is we are acquire that image, that is a tag image. Then another one is without 180-degree pulse. So that is control image. So we are taking that one, so minus by the control image, that is like an ASL image. It is a continuous process. It's a cycle. You can see the here. So we are applying that 180-degree pulse. The one is tag image. So another image. So black one is like a tag image. The perfusion is there now. That's a normal image is control image. So we minus, we'll get the perfusion imaging. So how that applied in our machines? So this is we are applying that radio frequency that we need a audio now. It's very important. But it's not there. We have to connect that audio. We move on to types of ASL. So ASL classified based on the magnetic label process. So one is a pulse, another continuous, third one is a pseudo continuous pulse. labeling. Another one is velocity selecting ASL. What is pulsed ASL? This is used single RF pulse to label the arterial blood, provide lower SNR, less commonly used. So this is the first ASL method. The RF wave is applied continuously to invert the blood. Requires like a specialized hardware and less commonly used. The inverted blood reduces the signal intensity, which allows you to see the difference between the two images. So this continued discontinued in 1990s. Another one is like a continuous like a ASL. Use non-stop. We are using that non-stop pulse for labeling for like arterial blood. Provide higher SNR and spatial resolution. Need specialized hardware and less commonly used in nowadays. So next one is like a pseudo-continuous arterial spin labeling. Use trying like RF pulses to label the arterial blood. Comfortable with modern clinical scanner. Nowadays we are using that pseudo-continuous arterial spin labeling. Provide higher SNR and spatial resolution. Widely used in clinical research applications. So like next one is like a flow sensitive alternative inversion recovery. It's called it as FAR. Uses combination of inversion pulses to label the arterial blood, provide high SNR and spatial resolution, less sensitive to magnetic field in homogenicities. The advantages of like ASL does not require the contrast, can be repeated, provide absolutely quantification of CBF, has better temporal resolution. This is most important in that like technologists or very of us. The sequences that is not fixed for like like ASL sequences. We have to go for depends on that clinical indications. In case of patients with like a stroke, you can go for like a diffusion weighted imaging and SWI, T2 flare and like a TOF image. Then you have to add one sequence that is ASL. In case of patients with like a seizure, you run the seizure sequences and then you have to do a ASL. In case of patients with like a press, you can run like angios and venogram and then you have to add a ASL sequence. So this is the planning. It's very, very important here. The plan the axial section in the sagittal plane. Slices parallel to line through the anterior commissure and posterior commissure. Slices should be covered from the off of the cerebellum. That is very, very important. That off of the cerebellum. 2 slices above the skull vertex. So this is a position of that ASL planning. Parameters, axial sections. So 240 FOV. The slice is 4. There is 4 lemma thickness and 36 slices. And 512 matrix and 3 next. Next is more important. So somebody is doing that 2 n next. It will give like an error in the images. I am going to show you that. It is a post labeling delay. Is most important in that ASL. So this post delay, post label delays, you have to change according to the age and so like a disease process. What is like a BLD? BLD is so like a time period between the end of the labeling blur, so like a pulse, end of the labeling pulse, and the start of the acquisition time. So like that is BLD. You can see here that a lot of BLD parameters are there. So it depends on that like patients and conditions, you have to change the BLD. So this is the sequence we are using like a BLD. So you can see the first one sound is so like the pulsing, second one is like a BLD, third one is like the acquisition of that images. You can see here now. The first sound is, then again that sound is the BLD. So this is a ASL technique. Okay. So important of that BLD is the optimal BLD allows that accurate CBF quantification, short and long, so leading to an underestimate of CBF. The factors affecting BLD is arterial, so like a transit time, and patient populations, like longer BLDs need for older individual patients with stroke or vascular disease and neonates. This is the parameters of that PLD. So usually we are using that 1800 millisecond. Yeah, I am converted into seconds 1.5. So that in units we use that 2000, more than 2000, because that flow, so blood flow is lower than the children's. So always we have to use that units, you have to use that's more than 2000 milliseconds. In children, so blood flow is higher, you can use 1500. So healthy patients are above 70, always use 2000, and Alzheimer's disease patients like that, you have to use more than 2000. This is a white paper published on 2015 ISMRM. So this is the standard protocol for PLD. So you can see the image over here. That's right PLD. It shows that nice image that the perfusion is very good. But to short and long, it will show that hypoperfusion is there. So always remember, please use that individual patient. You have to select the PLD. So you see here, you see the here. We use the normally adult patient. We use the 1800 milliseconds. You can see the image over here, so hospital imaging. So the hypoperfusion in 2500 is a normal perfusion. So because of that, so flow a patient with Alzheimer's disease patients, the flow is very less. So always you have to use that higher PLD for older patients. So another one is most important. Always preparations very very important. In case of patients with metal, you should not do ASL because it will cause that pitfall in reporting. So you can see here that ASL is angio, it shows that normal, but ASL it shows that the one of the half of this a brain which shows that hypoperfusion, but patient is normal. Because of that, a susceptibility out from the this metal. The another one is example, this susceptibility out test. You can see here because of that metal. So third one, you can see this. We are facing that patient in ICU every day. So always you have to check that all the patients, or you can see the pilot balloon contains metal. Then we see the image of patients with a seizure, no weakness at all. But see here, ASL shows that hypoperfusion in the right MC area. So sorry, left MC area. But we rectify that one. So stick that balloon. You can see the ASL. This is not. So always we have to remove that. You have to check the patient for ISL and all. So okay, you can see metal. So without metal. So that movement outfits. So very very important. So we are facing a lot of cases, patients with restless in acute stroke patients. So that patients with restless patient, you should not do ASL because it will give the error. This one, you can see this a small infarct is there, and we done is ASL, which shows that bilaterally infarct is a hyperperfusion. When with a sedation, you can see here that here perfusion is there. So always the restless patient, you should not do the ASL. Right. Next one is very very useful for ASLs stroke patient, HIE, migraine infection and inflammation, seizure and metabolic disorder. We will see one by one. So hemiplegic migraine, you can see here that a division weighted also is normal. The ASL is a negative, but it will say it shows that ASL, hyperperfusion is there. The another one is a seizure, a 40 is male. The early morning we had a seizure, alcoholic patient. We done MRI, so it will show that hyperurea in lab. You can see this ASL, it will show that hyperperfusion because of the post-ictal status, it will hyperactive. Another seizure, you can see this post-ictal edema, it will show that hyperperfusion in left MC area. So this myomia case also is very important in that ASL is very important. The another case one, this hypoxic is with encephalopathies. like some major cause death in disability during the first month of life, full term neonates. So you can see this like a global hypoxia. This is 7 years old male baby. So with like an electric shock, you can see this left lab. So everywhere hyperintensity is there, but here this is like a normal, but it images shows that normal. But you can see this hyperperfusion is like black. So it's a very dangerous critical case. So only we can identify in the like ASL. Another same case with like after cardiac arrest, you can see this hypoperfusion in that areas in brain. So next one is so like a press. Press is like after delivery, we have faced a lot of cases. This patient is like a seizure with a headache, and we done in MRI. So it will shows that normal in that flare negative, but OFF also normal. But you can see the hyperperfusion in the ASL. But flare it shows that hypo so like a hyper intense, but you will see the hyperperfusion in ASL. Another case, there's like a headache patients with the seizure. You can see the hyperperfusion in the occipital area, but you can see here that like the TOF is normal. The glioma is like it's a very interesting case. So always low grade glioma, so no perfusion. But here you can see the perfusion is there because that long standing that glioma so turned out to so like a high grade glioma. So critical, it's a very good case. You can see the hyperperfusion is very useful for the reporting for the radiologist. So this meningioma, you can say the hyperperfusion here. So like advantages of ASL in so like nowadays we are doing it because of that higher end modality. We can do it possibility in like placenta and lung and the ASL, so like in pancreas and renal, cardiac and liver, and it's okay. Like this is the advantage of ASL. Now you can see how that ASL happen here. So first we are applying that RFLs in that neck area. So that RF pulse is inverted, that blood is going inside. This like a blood means that protons is going inside and perfused here. We are acquiring that image, and after that we will get the like that is tag image. After that we will acquire that image, that is control image. We will subtract, we will get the like CBF image. This proton is going there, so moving. We are applying that, here you can see that we are applying RF pulse, the inverted, So that means signal loss. That means that signal loss, we are acquiring that image here. So you can see this moving here. So like this is perfused in all these advantages of the ASL. We are using that blood H2O now, so like it will perfuse everywhere in the brain. Okay, we come to conclusion. So MRI ASL is a powerful tool for assessing cerebral blood flow and perfusion. As a technologist, it is essential to understand the principles of ASL and optimize the scan parameters, very important, and analyze the image quality accurately to provide high quality diagnostic information. By following the best practice and stay up to date, very important, with the latest technique, you can help ensure the accurate and reliable ASL imaging results. So this is my reference. So that's next my like presentation in online. So thank you very much for